The following is a paid commercial advertisement for Tamoxifen. The views expressed and claims made do not necessarily reflect those of Central Michigan Physician Assistant Program. Are you a woman with breast cancer? Are you tired of having to go through chemotherapy? Sick of long drives to and from the hospital to receive treatments? Tired of having your hair come out when you brush it? Tired of feeling like your lunch is going to come out of both ends? Wish there was a way you could go back in time and prevent having breast cancer in the first place? Well, there's not, because time travel's impossible. But there is a way to prevent breast cancer from ever affecting you again. Introducing the revolutionary prescription Tamoxifen. Tamoxifen taken daily can help reduce the risk of developing breast cancer by up to 50% and is available through this special TV offer for only 4 easy payments of $19.95. Here to tell us more is our host, Jill Barson.
Hi, I'm Jill Barson. Are you a woman? Do you have breasts? Do you want to keep them healthy and cancer-free? If you answered yes to any of these questions, we have the product for you. Here to help us tell us about it is Alex Corcoran. Hi Alex, welcome to the show.
Thanks, Jill.
Tell us a little more about what makes Tamoxifen so special.
Certainly, Jill. Tamoxifen is a revolutionary product. By taking just one 20-milligram tablet up to 5 years, some women can reduce their risk of breast cancer by up to 50%.
50%? That's amazing!
And with Tamoxifen, 55 studies have showed that women who have already been diagnosed with breast cancer showed a 47% reduction of breast cancer in the other breast.
That's some pretty good odds. But tell me, how does Tamoxifen work?
Well, Jill, Tamoxifen is a selective estrogen receptor modulator that has both anti-estrogen and estrogen-like properties.
Whoa, that sounds really complicated. What exactly does all that mean?
Well, Jill, take a look at this typical picture of a typical breast cancer tissue cell.
Green half circles represent estrogen receptors in your cell. In order for estrogen to bind, it needs these estrogen helper proteins shown in pink to help bind the estrogen to the receptor. Now these red triangles are the Tamoxifen, and they have their own helper proteins in yellow. When the Tamoxifen binds to the estrogen receptor with help of the helper proteins, they change or modulate the receptor so it doesn't have the same effect on the nucleus, shown as the blue squigglies. It is thought that by blocking estrogen with its cell proliferative properties, you will stop a tumor from developing in the breast that causes breast cancer.
But aren't there other estrogen receptor modulators out there?
Why, yes. One of the main estrogen receptor modulators is raloxifene. Blech.
So tell our viewers what sets Tamoxifen apart from the others.
Well, Jill, I'm glad you asked, because in a head-to-head study, Tamoxifen was shown to have a 36% less chance of uterine cancer and a 29% reduction in blood clots.
Wow, that's great!
It gets even greater. Tamoxifen is the only agent currently approved by the FDA for primary breast cancer reduction in high-risk women and is currently recommended by the American Society of Clinical Oncology for women with a 5-year projected breast cancer risk.
Whoa, 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 whoa. What do you mean by high-risk women?
High-risk women include those that have risk factors including a first-degree relative that have had breast cancer, a breast biopsy that shows atypical hyperplasia, early age of menarche, those who have had pregnancy at a late age, or those who have not had a pregnancy at all.
Oh, all right. That makes sense.
And it's about to make a lot more sense, because in addition to today's special TV offer, we're also going to throw in a 3 times higher risk of venous thromboembolic disease.
3 times higher? That's amazing!
But wait, there's more. If you call within the next 47 minutes, we will also include an increased risk of stroke and DVT, absolutely free.
So with Tamoxifen, you get 3 times the chance of venous thromboembolic disease and increased risk of stroke and DVT.
That's right. And if you act now, we will throw in, as an extra gift to you, an increased risk of stage 1 endometrial cancer and uterine sarcoma for women aged 50 and above.
Wow, what a great offer. 5 great side effects to go with this great medication. But what does the USPSTF have to say about tamoxifen?
Well, the USPSTF does not recommend the use of raloxifene or tamoxifen in low or average risk women. But they do recommend all providers discuss chemoprophylaxis with those women who are at high risk for breast cancer.
Chemoprophyl what?
Chemoprophylaxis, the use of a medication to prevent a disease that the patient is not currently exhibiting symptoms.
Oh, alright.
It's also recommended that you should report to your provider any symptoms of vaginal bleeding, chest pain, shortness of breath, leg pain, or swelling while on tamoxifen.
That sounds like an amazing offer, Alex. So pick up your phone right now and call the number at the bottom of the screen to get your hands on this amazing offer. For tamoxifen, I'm Jill Barson saying do your monthly self-breast exams, have your clinical breast exams and or mammogram every 1 to 2 years, and get tamoxifen to prevent breast cancer.
Introducing the revolutionary breast cancer prevention agent, tamoxifen. By taking one simple 20 milligram tablet once a day, you can help reduce the risk of breast cancer for those at high risk. And with today's special TV offer, you can get tamoxifen for the amazingly low price of only 4 easy payments of $19.95. In addition to today's special TV offer, we are going to throw in a 3 times higher risk of venous thromboembolic disease. But wait, there's more! If you call within the next 42 minutes and 36 seconds, we will also include an increased risk of stroke and DVT, absolutely free. Could this deal get any better? Well, it just did. In addition, we will also throw in an increased risk of stage 1 endometrial cancer and uterine sarcoma for women above age 50. That's 5 great side effects along with a great medication. But wait, if you act now, we will double your offer so you can give tamoxifen to a friend and have them try it out risk-free. All you pay is shipping and handling. This offer is valued at over $1,500, but is yours today for only 4 easy payments of $19.95. Simply call the number at the bottom of your screen and ask for this amazing deal. Don't wait. Call now and receive your tamoxifen today.